Recent global research has revealed a concerning trend. Young adults aged 18 to 29 are experiencing a significant decline in happiness and well-being compared to previous generations. This shift challenges the traditional understanding that youth is typically the happiest phase of life. A comprehensive global study. A landmark study, known as the Global Flourishing Study, involved over 200,000 participants from 22 countries, including the United States, United Kingdom, Germany, Indonesia, and Mexico. Conducted by Harvard University and Baylor University, the study aimed to assess various aspects of well-being, including mental and physical health, life satisfaction, relationships, purpose, character, and financial stability. The findings, published in Nature Mental Health, indicate a troubling decline in happiness among young adults, particularly in high-income countries. Several interconnected factors contribute to the diminishing well-being of young adults. Social isolation. Despite being more connected digitally than ever before, many young adults report feelings of loneliness and lack of meaningful relationships. In the United States, for instance, 18% of young adults aged 18 to 29 reported not having anyone they feel close to. Economic pressures, rising costs of living, student loan debts, and job market uncertainties have placed significant financial stress on young individuals. These economic challenges delay milestones such as homeownership and starting families, which are often associated with life satisfaction. Mental health concerns. The prevalence of mental health issues, including depression and anxiety, has increased among young adults. Impact of technology. While technology offers connectivity, excessive use of social media platforms has been linked to negative outcomes like body image issues, cyberbullying, and reduced face-to-face interactions, all of which can adversely affect mental health. Global uncertainties. Issues such as climate change, political instability, and economic disparities create a sense of insecurity and helplessness among young people, further impacting their overall well-being. Regional variations. The decline in happiness is not uniform across all regions. Countries like Indonesia, Mexico, and the Philippines have reported higher levels of well-being among their youth, often attributed to strong community ties and cultural practices that emphasize collective well-being. In contrast, nations such as the United States, United Kingdom, and Japan have seen a decline in youth happiness, influenced by factors like social isolation and economic challenges. Implications for public health. The decline in happiness among young adults has significant public health implications. Persistent low well-being can lead to increased rates of mental health disorders, substance abuse, and decreased productivity. Addressing this issue requires a multifaceted approach, including promoting social connections, improving economic opportunities, and enhancing mental health support systems. Recommendations for improvement. To reverse the trend and improve the well-being of young adults, the following strategies are recommended. Enhancing social support. Encouraging community engagement and fostering meaningful relationships can mitigate feelings of isolation. Economic reforms. Implementing policies that address housing affordability, student debt relief, and job security can alleviate financial pressures. Mental health initiatives. Expanding access to mental health services and promoting awareness can help address psychological issues early. Regulating technology use. Setting boundaries on social media usage and encouraging offline activities can reduce the negative impacts of technology. Global cooperation. Collaborative efforts to address global challenges such as climate change and political instability can provide a sense of purpose and security for young people. Conclusion. The decline in happiness among young adults is a complex issue influenced by various social, economic, and technological factors. Addressing this decline requires concerted efforts from governments, communities, and individuals to create environments that promote well-being and support the mental health of the younger generation.